Maya State College, Pagadian Annex. And the intention and purpose of this visit to know who are the members of the organizational structure of the barangay health workers, and I have to ask about their policies, protocols, and guidelines, and also to determine the daily, weekly, monthly, and annual health programs and activities as mandated by and in accordance with the DOH, BMGO, and standards such as vaccination schedules and so on. So may I know you, ma'am?
Okay, I am Mary Grace Angeles. I am barangay health workers from Margo City.
Okay.
Members of the BSH of Poblacion Margo sa Tubig, Zamboanga del Sur's organizational structure include 1 DTTB, Dr. Mary Crizel de Hecacion. She is the one who will instruct and cue the healthcare personnel on what to do, as well as ensuring that the healthcare services are delivered correctly. Rosalie Ang, Donnie Ray Leong, and Johanna Lynn Lagnason are 3 public health nurses. The BHW records and analyzes aggregate medical data, evaluates patients' health, and develops treatment programs, and monitors patients for any changes in their condition, according to the BHW. Orfano Araceli, Anita Lambo, Jenica May Enoch, and Maria Paz Canuto are the 4 midwives. Their job is to deliver babies and give antenatal and postnatal care, support, and counseling to women, their partners, and their families. Nurisma Doral, Von Ryan Buico, Ronnie Saberon, Razel Joy Apario, Jenny Marasigan, Cheryl Billones, Rodlio Bukoy, and Clarice Noo are among the 8 nurses on the team. Their responsibilities include performing home visits, barangay visits, administering vaccines, and implementing plans for tasks such as treating wounds and monitoring pulse, blood pressure, and temperature, as well as observing and recording patients' conditions and checking and administering drugs and injections. And there are 33 health workers from different zones. In Zone 1, Mercy Hugo, Noime Rosales, Felipa Casio, Feji Candalanza. In Zone 2, Gemma Sabalya, Nancy Lamba, Intan Wahi, Shani May Sanlayan, Maria Rita Elorza, Nanita Wenceslao. In Zone 3, Myrna Cañales, Arsenia Lapasanda, Naume Sarita, Mary Grace Angeles, Merly Sandiala. In Zone 4, Tanya Lape, Grace Bagyo, Felicissima Cabaluna, Annalyn Casipong, Rankel Amulo. In Zone 5, Carlin Credo, Pilar Labatigan, Eileen Mariano, Crystal Candelanza, Epen Len Saak. In Zone 6, Melodia Udtuhan, Aisa Gandawan, Nejin Sarita, Nelia Acebes, Melja Sakandal, Ami Kapas. In Zone 7, Josephine Cambong, Bernardina Lunas. Their duties include assisting with the BHS, delivering vitamins to various homes, and assisting with family planning. The nurse rotates 3 days a week from 8 a.m. to 5 p.m., and the midwife rotates 3 days a week from 8 a.m. to 5 p.m. for vaccinations and other activities. Every day, the BHW is taken twice from a different zone. They have a systemic policy, processes, and recommendations, according to the BHW. To assume command of the BHS office, supervise its personnel and staff, and develop program implementation guidelines and rules and regulations for the operation of the office for approval by the governor or mayor, as the case may be, in order to assist him in the efficient effective, and cost-effective implementation of a health services program geared toward the implementation of health-related projects and activities. Pregnant women must visit the BHS for prenatal and postnatal care, and both personnel and clients must wear a face shield, face mask, and follow social distancing rules, as well as always disinfect their hands. Vaccinations are scheduled for Wednesday for Category A1, Thursday for Category A1 and A2, and Friday for Category A1, A2, A3, and A4. But they also serve those who come to the station who are not part of the vaccination plan. Home visits, consulting, and being pulled out by the RHU due to a large population are just a few of their daily activities. Weekly activities: check for their barangay healthcare personnel by zone, inquire about their job, and visit pregnant women on a weekly basis. Monthly activities: conduct advocacy, schedule prenatal, COVID-19 vaccinations, test blood sugar, monitor high blood clients, postpartum visits, and contact pregnant women on a monthly basis. Doing radio campaign programs for COVID-19 and putting up tarpaulins in every purok. And if governments provide financial help, they will take advantage of the opportunity to raise protocols in the specific place about COVID-19. Annual activities include GP visits twice a year, global deworming every 6 months in January and July, and HPD immunization for children aged 9 to 13. Other currently running programs include vaccines for infectious diseases are being distributed in barangays.